morning. It's good to be back in Michigan. I see a lot of friendly faces, and I had a really great 2 years during my EIS, so it's always nice to be back. Now, my topic is a little tricky because I have to talk about a bunch of different things, so I'm not going to go too much into detail on every single trend. I probably could spend the time talking about a single trend the entire time because there's just so much information I could provide. What I would like to say, though, is that the statements that I'm making here do not necessarily are not necessarily those of my agency. We are required to say those things now. So before we get started, we're going to play a game. And it might sound a little silly, but there's a reason why we're going to do this. And I think some of you might have seen this before or have played this game before, so don't give up the answer. So let me cue it up. Let's see. Yeah. So this is what we need to do, or we have to do. You have to count the number of times the players wearing a white pass the ball. So I'm going to start it. So see if you can get it right. All right, here goes.
Pass the ball.
Okay. So you can start counting when they start passing the ball. Okay. How many times did the girls in white pass the ball? 16. How many of you noticed a gorilla? How many of you noticed a girl in black leaving there, moving away? Yeah, not too many. How many of you noticed the background color changed from red to slightly orange, pinkish? All right, I'm going to play it again. Watch carefully. Let's see. Start from here. Okay. And now I'm going to point out what happens.
Wearing white, pass the ball.
That's the gorilla. That's a little dance. See the background color changing? The girl in black left. Okay. All right. I'm gonna pause it here. So I'm guessing everyone wants to know why I'm doing this. Well, when I got up here, I noticed about half of you were falling asleep, so I decided, hey, this might work. Well, that's not it. But the point of the matter, or the fact of the matter, is that when we're so focused with what we do, our workplaces, families, etc., we develop this sense of a tunnel vision that we don't actually see what goes on around us. So a lot of the things I'm going to talk about here, I'm pretty sure that most of you have either seen them on the news, read about them somewhere else, maybe understood the significance, but over time, you probably just either forgot or something else took place. So what I would like to point out is that these things are real, these things impact our lives, and that we need to either try to better understand how they impact our lives and sort of protect ourselves against them, protect our families, etc. So I'm going to start off with black lung disease. Now it's pretty strange that I'm talking about this because this was supposed to have been eradicated a while ago when the Mine Safety Act was passed in 1969. Actually, the levels, well, it was pretty much almost eradicated, but levels started coming back up. So why is it important, or why am I talking about this? It's also called pneumoconiosis, or co-workers pneumoconiosis. And it's caused when the miners breathe in excessive amounts of coal dust, at their workplaces in the mines. Your chances of bronchitis or COPD are significantly increased as a result. And there are two forms of this, the simple and the complicated form. What I want to point out is that the progressive microfibrosis that's associated with the complicated CWP, it's pretty substantial. Basically, when you have this condition, you are living a life of misery. I mean, you are gasping for air for the entire time you're living, and there's no cure for it. So I'm going to show some data on that in a little bit. So this is the progression from a healthy lung to a diseased lung. The healthy lung tissue is the one on your left. And then when you work in the mine for 10 years, what you start developing are these small stains, hardened areas, swelling, and you also see all these coal nodules, the scarring distributed throughout the lung, which progressively get worse. So at 20 to 30 years in the mine, it gets progressively worse. You basically lose a lot of your lung function. So it was surprising when last year this paper came out. I was actually visiting the mines in West Virginia. I spoke to the authors of this paper. It was shocking that this came out, and I'll show you why. So this is a reporter who describes it, and I just like the way he put it. Most coal miners die alone, one at a time, either in a roof fall or equipment accidents. Incredibly, in this age and day and age, from black lung, a deadly but preventable disease that most Americans probably think is a thing of the past. Coal mining disasters get historic markers. Black lung deaths just get headstones. That's pretty sad, but it's true. So let's look at the rates. In the 1970s was an all-time high, and when the Mine Safety Act was passed, it kind of went down again. And between 1995 and 2000, we thought we'd gotten a hold of it, and now look at it, it just spiked up. And this is progressive massive fibrosis. So this is the advanced form of the disease. So basically, there's no cure for it, if you remember what I just said. And there are people living in the country, or in this country, that are living with this condition, and we don't even see it on the news, for that matter, but it's a significant problem. So when I spoke to the authors of this paper, I actually did visit the mines. I mean, if you've visited a mine, you pretty much are stooping the entire time. It's dark, it's pretty scary out there. So you're there in those conditions, and you're breathing in this massive amounts of coal dust. It's not a very pretty scene. But these guys are having to work for longer than necessary because they are basically expendable. If you don't want to work, someone else is waiting in line. So what you see is an 18-year-old right out of high school. He gets a job in the mines. They pay pretty well, so you can afford a truck and etc. And so they know what's going to do to them, but they also want to enjoy having money to purchase things they want, which is sad. And because we're drilling deeper, there's evidence that suggests that there's a lot more toxicity in the dust compared to several years ago. So there are certain rules and regulations currently in place. I mean, although I don't think they are going far enough, they are trying to lower the levels of coal dust in the mines. And before, coal dust miners used to wear sort of a filter, and then they would have to submit it to their bosses, and the bosses would have to submit it to their authorities. But what happens was that the bosses would either change the filters or submit false data. And so now they are required to wear this real-time electronic monitoring devices. But the fact of the matter is that the mining companies are still they are still there, and so they are going to probably find ways to manipulate the system. So it's an ongoing problem, and we need to watch out for that. So let's go to light pollution. So it's described as excessive or inappropriate outdoor lighting. I think I can make a case for indoor lighting pollution too. So last night I was trying to sleep, and I had all the lights in my room turned off. But I noticed I could still see in the dark. It's pretty strange. And so I looked around to see what, there's other sources of light. The digital clock, it's that red blinking. Your laptop has a beep or whatever, a light. That your cell phone, these little things like that, they all contribute, and they impact sleep patterns and things like that. But the common forms are the glare, where you see the excessive brightness, and it causes a lot of visual discomfort. Then there's the sky glow, light reflects out, shines back down. over areas that are inhabited. It's a problem. And then there's the trespass, where basically there's light where you're not supposed to have it. And then there's the clutter. You have different sources of light emitting different wavelengths of light. It's not a very pretty thing. So let's take a look at this picture. This is a street lamp here. The area in the yellow, that's where it's supposed to light. But basically, because or a combination of the specific light bulb that's being used and the way the light bulb is positioned, it's spreading light to areas that's not supposed to. So we have light going to these guys here. I hope they have very good blinds, because they're probably not very happy. The guy here is screaming, "My expletive eyeballs." I mean, I probably would do the same thing. And then you have this light reflecting upwards, reflecting back downward. Again, this is the area that needs to be lit, but we have all this spread. So we are basically wasting energy, and we're also causing a lot of discomfort. This is the map that shows how, so this is a NASA image taken from space. It shows the Earth at night. And you could see that the only areas that maintain true darkness, that's at night, probably Antarctica, Antarctica over there, the Sahara Desert, and maybe the Amazon jungle. But it's just an infiltration of light. There's just light everywhere. Everything needs to be brighter, and everything, it's just getting worse. And this is an image from San Francisco. I mean, it's pretty, yeah. But I'm sure, I'm sure a lot of cities look like this when you take pictures of them at night, right? Now, what we see here is a phenomenon called a glow bomb. So this happens when you use incorrect lightning bulbs, and also when the lightning bulb is sort of turned upwards. You really want to, you want your light to shine or in a certain area which is sort of downwards, not upwards. So why would you, turn over, like have the light face, slightly upward? It causes problems. So you see that effect, and that is blinding, and it's not very pleasant. So I'm sure the residents or inhabitants of these homes are not pretty much excited about this. So there are lots of negative effects of light pollution. A lot of this has been documented. But 30% of vertebrates are nocturnal. 30% of all vertebrates. 66% of invertebrates are also nocturnal. The rest are crepuscular. That means they are active from dusk to dawn. There's a lot of evidence suggesting that every year millions of birds that are migrating, they die because they collide with man-made objects because of the artificial lightning. So they get disoriented. With regards to human beings, having too much light, it affects our bodily functions, our circadian rhythms. So your body knows when it's dark, when to sleep, when to wake up. When you have too much light at night, that impacts that. So you're not sleeping well at night, and that increases your risk for cardiovascular disease, diabetes, you name it. So what did France do? They got pretty aggressive. They put in an ordinance basically requiring all shops to turn their lights off between 1 a.m. and 7 a.m. And then the lighting on the building facades, they cannot be turned on until sunrise. And they also have proposals in place to limit or restrict billboard lighting. So in all, they estimate that they're going to cut down their carbon dioxide emissions by 250,000 tons per year, and they're also going to save significantly in energy bills. But the main reason why they're putting this in place is to reduce the print of light, at night. So that's one of the main reasons. I don't think some of the citizens are not so happy, but they're doing something about that. And I think some cities in the United States, I believe Connecticut, and I think there's another state that's also putting in lightning ordinances. So there are things we can do to reduce light pollution, a number of things. You can research to use the low pressure sodium lights. They will provide light to a specific area needed, and they also save energy. You can, for lights that are already out there, you can retrofit them to have the light pointing downwards instead of everywhere, and you can install motion sensors. So if you don't need light at night somewhere else, there's no need for it to be there. You close your curtains so light doesn't sort of come out and affect other people. And if you really, really, really want to get into the whole, getting back into the whole dark thing, there are groups out there. The Dark Sky Preserve, so it's a group that individuals sort of try to capture or gain. I mean, there's a caption, take back the dark. They're trying to minimize the impact of light in the night. So moving on to the built environment. There are so many definitions for the built environment, but the one that I like the best is from the Public Health or the Prevention Institute, which says that the designated use, layout, and design of a community's physical structures, including its housing, businesses, transportation systems, and recreational resources, affect patterns of living or behaviors that in turn influence health. When you think about it, it's actually very true, and we'll see why. So, in communities where there are no sidewalks, folks are less likely to go out to walk, ride their bicycles, etc. And so you see high levels or increased prevalent, obesity rates will probably be higher in those communities, risk for other diseases might be higher, etc. This impacts the health of both children and adults. And then we see the concept of gentrification, where upper and middle class individuals try to sort of increase the value of their communities, and so buy back properties from lower income families and so on. And that also has an impact in how the community is designed, because most of the time, these places that are bought are not necessarily turned into parks or things that might benefit individuals in the community, so it causes other problems. And we have a whole list of issues that are related to how communities are designed, and I'm not going to go through every single one of these. But CDC has an initiative now where they are trying to develop healthy communities. This is in the works, I think, for the past couple of years. And basically, these are some of the things that they think are important in terms of what a healthy community should be. So decreased dependence on automobiles. So you should be able to go places without always having to get into a car. I mean, I should be able to walk to a grocery store, or I should be able to walk my kids to school, ride a bike, etc. This makes it possible for people to be physically active, and that reduces the chance of lots of cardiovascular diseases. And also, when you think about it, most people who are elderly, they have an attachment for their homes. It's very difficult. If you have an elderly parent, you know how difficult it is to send them to an elderly home. They get attached. So, when you're building a home, you think about, okay, I'm going to be living here probably the rest of my life, so maybe I shouldn't build a 4-story home, because when you're 90, you probably can't climb those stairs to get up to the top floor, right? So try to make it in a way, or build a house in a way that you sort of can age into. And then also having affordable food. So not a McDonald's, or, I guess McDonald's is trying to be healthy, but I'm not certainly promoting their activities. But places where you could buy fresh produce, etc. You need to have all of this in a community, and that makes it healthy. So then nanotechnology. So this is pretty exciting technology, because the possibilities are just endless. It's just so much that could be done with this. So the sizes of nanoparticles are between 1 and 100 nanometers. So this is the size of a protein molecule, DNA, or a virus. So we're talking at a very, atomic level. Very small levels. There are so many applications for nanotechnology currently. There's a lot of research going into nanotechnology, because it's really it's pretty unique technology. But a lot of manufacturing, measuring, imaging, manipulating matter is being done as a result. Now, there are advantages of a nanoparticle. So you're talking about a little, minute particle, but it has a large surface area. So when you think about it, it can actually hold a lot of information on that volume. And then you can also change the properties of a nanoparticle, at the nano level. So you can change it to anything you want. That's pretty exciting. You could probably do a lot with a particle, which traditionally may only have been doing a specific thing, but now when you get it to the nano level, you're able to change it into something else. So the benefits in manufacturing, energy consumption. Nanoparticles, because they are so efficient, they have the potential of reducing energy. There are so many ways they can save on materials, because you can manufacture a nanomaterial to be much lighter than traditional, traditional materials. So then you're saving a lot of money as a result. There's less waste, etc. I'm going to, so, and it has applications, biological and biomedical. You can use this as probes. You can, if you wanted to, say, get some chemical into a certain part of a human body, you could engineer that onto the nanoparticle, and they are so small you can get them in. So there's the possibilities there are also endless. I'm going to talk about graphene. So this is a very unique compound that has nanoparticle, it's built around the whole concept of the nanoparticles are basically used in developing this. But it's significantly able to, when used, it significantly reduces the weight of airplanes. So when you substitute the traditional components that are used in building an aircraft with graphene, you have a lighter plane. So when you think about that, the plane uses less amount of fuel, and the airlines are happy. And also when you put it around the fuselage of the airplane, it reduces the risk for when you have things like direct or indirect effects of lightning strikes. So it significantly reduces that. And then for a wind turbine, you really want your wind turbine to be as light, the blade to be as light as possible. So then you think about it, when you use a graphene product for your wind turbine, it's able to generate a lot more energy than a traditional product. So it's exciting in that sense. So there are a lot of positive effects for using nanotechnologies, cleaner environment, increased efficiency, etc. And a lot of people just look at these, but there are also negative things that nanoparticles can cause. So it requires a lot of energy to develop a nanoparticle or build one. So it's using a significant amount of energy that impacts the environment. Now, there are byproducts of nanoparticles. So some of them could be toxic. I mean, nanotechnology has not been around for so long, so there's still a lot of unknowns. So sometimes these things are toxic and they are released into the environment, but we don't really know how to measure them, and so forth. The lower recovery and recycling rates. So they're in the environment, they're so minute, it takes a lot of time to try to get them out, if you can even find them. And trying to recycle them, of course, is a challenge. And there's just a lot of things that are not clear. And plus, we don't have enough professionals, who know so much about these things. So it's really a concern moving forward. So the exposure to unknown hazards, I'm specifically going to talk about chemicals. So we have about 85,000 chemicals in commerce in the United States. So this means that they are being actively bought and sold. An estimated 80,000 of those have not been tested. So we don't have any animal models on them. And of course, we don't have any human tests on these. So these chemicals exist there. They have the potential, of course, in a lot of harm, but basically nothing has been done about them. And then we also have this high volume or high production of chemicals. So these are ones that are manufactured at a rate of greater than 1 million pounds per year. And we have 25,000 of those, and of that number, 45% lack toxicological studies. So tox studies in animals and, of course, in humans. We still see a lot of new chemicals being introduced into the U.S. Every year, approximately 2,000, and that's about greater than 5 a day. So that's a lot of chemicals that are coming into our system that we don't know anything about in terms of their potential adverse effects. So the chemicals are everywhere. Toys, basically anything you think about has some type of a chemical. So we are not safe from them. So we can't, hide somewhere and think that we are protected from them. They are basically everywhere that we are. And some of the health consequences that have been replicated, endocrine disruptors. So the endocrine system is the network of tissues that basically produces all these hormones that are critical to our bodily functions. They've seen effects in the parts per billion. So this really small quantities of these have effects on the endocrine system. And they're transgenerational effects. So it doesn't mean that if you get exposed to it, you are the one who's suffering from it. Your children, your grandchildren, etc., they can all suffer from the effects of these chemicals. And a lot of the chemical mixtures, we don't know. There's a lot of mixing going on here and there. We don't know what the effects are. So it really is a problem. The current risk assessment model looks something like this, where you have to identify a hazard or characterize a hazard. Then there's an exposure assessment, and then etc. You keep going. So that's what it is. But that really doesn't suit, determining risk for a particular compound. And so for the endocrine disrupting compounds, well, first of all, they don't have a universal definition. So if there's no universal definition, how do you actually go and characterize the risk? It's almost impossible to do that. There's incomplete data, so it's difficult to try to piece out different reasons why something might be happening. And then there's long-term exposure. So it's not that you get exposed to a chemical and then you see an effect maybe in a year. Some of those things you see 5, 10, 15, 20 years down the line. How do you track all of that? It's a significant challenge. The endocrine disruptors, they also work sort of differently from other types of compounds. So you can't try to correlate how a compound that, say, affects maybe the liver to a compound that disrupts their endocrine system. The mechanisms are completely different. And we see other effects. So the Toxic Substances and Control Act. This is an interesting one. So I don't even know where to start, but this law was created in the 1970s. It has so many loopholes. Well, first of all, most of the laws that were created several years ago, so like the Clean Air Act, etc., they've been revised. The Toxic Substances Control Act hasn't been. It wasn't necessarily created as sort of, it wasn't really sort of an enforcement. They basically gave the EPA, sort of a framework to take action. But let's look at, so this is section 4 of how to determine to test the substance. So substantial production and importation, that's greater than, well, 1 million pounds of a chemical, substantial release into the environment, substantial human exposure. Okay, so let's take this first 3. Think about how much work the EPA would have to do to prove all of those 3 before it decides to take, some form of action. It's a lot of research EPA has to do, and a lot of times the courts, they also interpret the law the way they want. So it's really hard to do anything. That's why we've seen all these chemicals coming in without being tested. I mean, they do have this case-by-case basis, but I don't think that's enough. So as one of the authors put it, he said, more than at any time, risk assessment is at a crossroads. One path leads to retaining the status quo, the other to a challenging but less certain future. Let's hope we have the wisdom to choose correctly. I think he summarizes this well, because this would probably go really bad if steps are not taken in the right direction. So let's talk about noise pollution now. Have you had enough? I hope I'm not scaring you. I mean, I'm sure you know about these things. I'm just sort of re-highlighting them. Okay. So the former U.S. Surgeon General in 1978, he calls noise, or calling noise a nuisance is like calling smog an inconvenience. Noise must be considered a hazard to the health of people everywhere. I wonder what he would say now. This was 1978. And think about how much noise, we have now compared to 1978. So what is noise pollution? It's compared to air pollution, it's the second biggest environmental health problem. Very significant. And traffic-related noise, so this is cars, railways, airports, etc. They account for 1 million healthy years lost every year. That's a lot. So 1 in 3 people experience annoyances anytime during the day, and 1 in 5 people have difficulty sleeping, all because of noise. It's only going to get worse because we're seeing more cars, we're seeing more planes or airplanes, etc. I think very soon we might see drones flying around here, right? Yeah, it might come to that. So between 1981 and 1991, there was an increase of 10%. And I think if I look at the numbers now, it's probably even more than, within that time frame. Where the 2000 U.S. Census indicated 30% of Americans indicated that, or complained about noise, and 11% found it bothersome. And 40% of Americans, well, so actually of the 30% of Americans that found the noise bothersome, 40% wanted to move or change their place of residence. And you don't just pick up and leave when there's a little bit of noise out there. It has to be significant because moving a home, it's a pretty big step. So for you to say that I would want to move because the noise level is so bad, and it has to be pretty significant. So has any one of you ridden in the New York subway? Those things are pretty loud. So 106 decibels, it's equivalent to a jet taking off, 300 feet away. Or when you start a power, a power mower. That's a sound level you are experiencing when you're on the platform. And when you're inside of the platform, 112. So this is extremely loud noises we're talking about. Okay, so what are historical attempts that have been done to curtail noise pollution? So in Rome, the chariots were banned at night because folks were getting tired of the noise. They wanted to sleep. A couple centuries later, medieval Europeans also banned horse-drawn carriages. Same reason. There's too much noise. We want to sleep. And then quite recently, during the framing of our Constitution in Philadelphia, the framers, they covered the cobblestone streets with earth. They needed to concentrate. There was too much noise. So it has been a problem, and then it's gotten worse. So some of the adverse effects of noise pollution, there's a hearing impairment. It interferes with spoken communication, because if there's a sort of loud noise out close to you, you are forced to speak louder. You can't hear what the other person is saying. It gets annoying. And there are all these different adverse effects. So it is a problem. So this is a map of the United States that shows background noise levels. So this is actually a project that they are doing to see how background noise levels affect animals and birds and things like that. But you can pretty much see that most of the major cities have increased thresholds of background noise. So you probably have to go to the Yellowstone somewhere there if you want if you wanted your peace and quiet. And I'm sure this is probably going to get worse as time goes on. So climate change. You must love this one. So what I'll do for climate change is I'm just going to show the numbers of things that are sort of correlated, or the significant changes as a result of climate change. We are seeing carbon dioxide levels at the highest in 650,000 years. You see, and these are direct measurements from 2005 to present. It's sort of just increasing steadily. And then for global temperature, we're seeing the exact same. So except for 1998, since 2000, 9 of those 10 years have been the warmest on record. 2014 was the warmest year on record. So it looks like this is also going up. And then for the Arctics, sea ice. So this is the September extent. So during September, that's the lowest level of ice. So that's when they take this measurement. But in 2012, the summer ice extent has shrunk to its lowest levels. And when we see, it's going on a downward spiral. What about the land ice? So we've seen a lot of ice loss between 1996 and 2005. So this is Greenland. They lost almost half of their land mass since 2002. In Antarctica, it's not pretty far off. So there's a lot of ice or land ice being lost. And basically when that happens, you have high sea levels, etc. So then at the sea level, of course, that's also increasing. It's increased 7 inches over the past 100 years. And moving on, the forest cover. That one thing that's also we've been losing so much. So between 2000 and 2012, a lot, more than twice the area of Texas was lost. So these are pretty significant, significant things happening. So this is just a snapshot of some of the impacts that climate change is supposed to cause on human health. We are seeing a lot of different, well, we're seeing tropical diseases moving from where they traditionally were to more, temperate climates. In Florida, I think you can now find the Aedes aegypti mosquito. So this is the one that transmits yellow fever and I believe chikungunya. So there have been some cases there. There's projections that we might be seeing malaria around soon because the Anopheles might decide that, hey, it's getting warmer here. Why not move here and try to find a life for myself? So, these things are all as a result of climate change. And then malnutrition from crop failures, because when it's crops sort of, the way crops are, the various seasons. So when it's too hot, when it's not supposed to be too hot, the crop might die, and that significantly impacts the availability of the crop for people to eat. And then also there's going to be a lot of this flooding, or the projected inland and coastal flooding as a result of the increase in the sea level. So radon, how much time do I have? I might not. Okay, 5 minutes. I'm going to skip, so I'm going to go really fast on these one. So radon, these are some of the ones we already know, but the reason why I have them on here is because they are never going away. We're still seeing lots and lots of cases. I mean, we know about these things, but they're still around, so something needs to be done. Okay, so I'm going to move on. Let's show this graph right here. When we look at the deaths from radon, so radon causes lung cancer. When we look at radon compared to other causes, it's still high. And these are 2012 data. So compared to drunk driving, falling in a home, drowning, etc., radon levels are still high. We need to test for radon. I mean, we know about this, but do we actually test for radon in our homes? We've probably forgotten about that, or I'll check it another time and forget about it, and so forth. We need to do that. This can cause lung cancer. This can kill you. So I'm going to skip past this, and I'm going to also show this map. There's radon in every part of the United States. So don't think that you live in an area where you're protected. It's pretty much everywhere. And then when we look at Michigan, so for those living south of Michigan, they have it worse, but it doesn't mean that if you're in the yellow. So if you're in the blue, it means you have greater than 4 picocuries per liter. That's sort of the threshold, but there is no safe level. Every level can potentially cause problems. So if I were to quickly show this here, sorry, right here. Yeah. So at 1.3 picocuries per liter, 2 in 1,000 people still can develop lung cancer. So it's a problem, and we need to take care of it when we can. All right, and I'm going to quickly talk about child-lead poisoning, because that's also something that's not going away. So between 1960 and 1961, the thresholds were set at 60. And but there's no safe level for lead. And, there's no documented safe level for lead. It can cause severe problems, all parts of the human body. They recently changed the threshold to 5. 5 micrograms per deciliter, blood levels. But what do we see here? These are the U.S. totals for lead, based on the lead surveillance. It's kind of stagnant. It's not going away. The problem still exists. A lot of people are still dying, or a lot of kids still suffer from high levels of lead exposure. So what I wanted to show, this is pretty small, but these are the numbers for Michigan. Michigan has done a good job. I mean, we've dropped it down from 17% down to 0.55%. But until it gets to 0, I don't think our work is done. We need to keep testing. So if you're worried, get your child tested. You're not safe for it. I mean, because we don't know where you live. You don't know what happened there before. So there's chances that the soil could have lead. And then between 5 and 9 micrograms, micrograms per deciliter, we're still pretty much, there's a lot of people who have those elevated blood lead levels in Michigan. So it's something we should watch out for. So I want to talk about emergency preparedness really quick in the context of environmental health. So this is sort of a new paradigm, basically trying to integrate environmental health and health preparedness. Because when you think about it, if there is an emergency or a natural disaster, there's always a significant environmental health component associated with it. So it makes sense for those two sort of to be linked together. So then you can leverage both environmental health professionals and disaster preparedness professionals to think about ways to solving the problem. And another thing about doing this integration is that then you have communities that are more resilient. It means that they are able to prepare for these situations. You're thinking ahead. If there's a disaster, what am I going to do? And so we did a CASPER sometime last year, and I think a number of you here were in this CASPER where basically we're trying to determine how prepared Oakland County was for a natural event. Now, I'm not trying to generalize the results of this findings to anything else, because this was in Oakland County. But if we were to do this study in other counties, I'm probably sure we'd see maybe similar. I mean, it's feasible, but I would see similar results. So to show some of the main findings, I just want to look at the percentage of households that need medical supplies. It's pretty significant. Daily prescriptions, the wheelchairs, and other home care. So there's a lot of people who need some form of health, medical supply. Now, if we take a look at how prepared we are for a natural disaster, or how prepared Oakland County residents were, and I'm not putting Oakland County, on the spot here. This applies to pretty much all of it. I bet if I asked you whether or not you had, 3 liters of water in your home, you probably would say no, right? Yeah, I thought so. So those without 3-day non-perishable supply of food, 84.9, and those with ways to cook food without utilities, we had 75.5. We need these numbers to be higher than the 90% threshold. I mean, I think the EPA set 85, but that's just the lowest limit. We need these numbers to be as high as possible. So in a nutshell, we really are not prepared for natural disasters. So I'll end by saying 2 things. First of all, we need to watch out for those gorillas, right? Because we just have this tunnel vision and we forget what's going on around us. So let's watch out for that. And secondly, there are things that we can't prevent. So we can't prevent a natural disaster, but we can protect ourselves against it. We can make sure that we have those supplies, so we have a place to shelter in place, or this adequately prepared in the event that happens. So if we're able to do that, we get to protect ourselves a little bit better from these environmental hazards and tragedies. So thank you so much for listening, and it's been a pleasure.
Thank you very much, Dr. Nyaku. That was wonderful. Okay, we're going to break for lunch, but before you get up, don't get up yet. Make sure you visit the sponsors and the posters. There are a few meetings taking place during lunch. The MAP meeting is in room 2690 on the 2nd floor of SPH1, so up the stairs across. The MPHA Epi Section annual business meeting will be held in room M1152, and that's just behind here. And then the Careers in Epidemiology Roundtable discussion will be held in room 1655 of SPH1. The first breakout sessions start promptly at 1. Thank you.